So let's talk about how and what original Medicare is. Original Medicare, again, is parts A and B. So in 2019, the government has put in place a new deductible of $1,364 for the stay. You're admitted to the hospital, you have from day 1 to day 60, that deductible applies. Now, think about this. Medicare came out in 65 and 70. We didn't have assisted living. We didn't have the nursing homes the way we do today. We didn't have the therapy outpatient the way we do today. So someone staying in the hospital for 60 days wasn't an uncommon occurrence. Today, it is. If you're in the hospital for 60 days, you have some major problems that we're trying to deal with. But let me ask a question. If I'm in for 10 days and I'm released and I come back on the 30th day, do I have a new deductible? Anybody? No. Remember, it's 60 days. So you were in on the first day, you came out on the 10th, you came back on the 30th, it's still within that same 60 days.
How about within the next year?
No, that's the key. As soon as you get beyond that 60 days, now you have another deductible. So there is a really outside chance that somebody could have 4 of those in a year, 1 each quarter. I've never seen it. Worst I've seen is 3. But 3 times 1,300 is a lot of money. Okay? So if you were in the hospital on that 61st day, from day 1 to 61, now we're going to change the rules, and it's going to be $341 per day that you pay for your care. Okay? If you go beyond that 90th day, then we have a $682 copay, or what they call lifetime reserve days. Again, in today's healthcare world, that's nearly impossible to meet. All right? After that 150th day, all the expenses are yours under original Medicare. You have a $0 copay for the first 20 days of a skilled nursing facility. Now, the key phrase is skilled nursing facility. You have to have been admitted to the hospital. The doctor is releasing you and having you go to a skilled nursing facility because you need additional care. You don't qualify to be in the hospital, but you need skilled care. Skilled care is different than home health or assisted living. All right? Assisted living is not covered under Parts A and B. You also will have a $170.50 copay for the 21st through the 100th day if you're still in skilled nursing care. After that 100th day, then again, all costs are yours in skilled nursing. Part B. What did I say Part B was? That's what you're paying a premium for. No, not B. B. There you go. Outpatient. Part B is what you have to enroll in with the federal government. That premium for somebody who's turning 65 today, in 2019, they will pay $135.50 per month. Last year that was $134, so it didn't go up a lot. But you're paying that no matter which road you go down. You're going to pay that to the government no matter which road you go down. Okay? There is also a deductible under Part B of $185. Last year it was $183. So again, these numbers don't change a lot, but you need to be aware they're there. You also have a 20% coinsurance of Medicare approved for doctor services outside of in Part B. That includes therapy. It also includes durable medical equipment. There can be various outpatient copays, deductibles that could apply also. All right? You have a 0 risk for Medicare approved home health services. As long as you've been in the hospital and Medicare approves home health, you're not going to pay for that. Medicare will. All right? Same with lab services. And after the first 3 pints of blood, the blood cost is yours. So you can see how Medicare has put some of this together. Now, Medigap and Medicare Supplements are the same. Medicare Supplements are the various plans that the government has put set guidelines to, and they cannot change. Those plans are identical. No matter what insurance company is selling it, that plan is identical. The insurance companies put these together to be Medigap, or to fill the gap in Medicare. So what we're looking at is that $1,300 deductible, that $185 deductible, that cost after your 3 pints of blood. That's what we're talking about when we talk about the Medicare gaps. So as we talk about the plans themselves, these plans do not change. Doesn't matter whether you buy it from Blue Cross, Mutual of Omaha, AARP, Humana, okay? These have to be identical. The only thing you're going to see different in these plans, one company to the next, is premium and what their star rating is. We'll talk about that in a little bit. And what their reputation is. How quickly do they solve your problems? Are they a good customer service company? That's what you're analyzing when you're talking about original Medicare supplements. So these are supplements over original Medicare. Now the most popular plan is Plan F. And the reason for that is Plan F is what we call the zero cost plan. All you pay is your premium. Everything else under here, as long as it's Medicare approved, is going to be paid by the supplement. So your deductible, that $185 deductible we talked about, plan pays it, you don't. That $1,300 for the episode, okay, Plan F pays that for you. So you're not paying anything out of your pocket except the premium. Now the next most unpopular plan is Plan G, because the only difference is that no right there, and that's on the Medicare Part B deductible line. So in Plan G, you get a reduced premium to buy it because you're now absorbing or paying for that $185 deductible. Okay? That simplifies as much as I can Medicare supplements. Plan F or Plan G? Yes?
I heard that F is going away after this year, unless, and it may be grandfathered.
You are correct. It is grandfathered or will be grandfathered as we understand it today, but it is not being taken away until 2020.
So don't think about it.
Don't think about it right now.
Time,
Yep.
but if
Next
you
year at
want
this
to-
time we'll be talking about it. Yes, correct. Okay? Any other questions on these?
Well, if they take away the F, do they put you down to G or what?
No. You have the opportunity to keep it. Okay? So if you have Plan F today and you want to keep Plan F after 2019, you can. Okay? There's nothing, right now the government is not taking it away. There used to be a Plan J in these mix. Plan J they took away back in 2006 when they did the drug plans, because that was the only plan that included drugs. Okay? So that plan isn't available anymore. Somebody who has it, I had a lady 3 weeks ago in Missouri, she was all excited because she has Plan J. And I said, keep it. You don't have to do anything. All right? Very important. Good question. So another relatively new item is accountable care organizations. Accountable care organizations are hospitals and physician groups coming together to work to provide more effective and coordinated care for the members. Hospitals and physicians are rewarded or penalized based on outcomes. This is what Medicare has set forth. They say here are some guidelines these hospitals and doctors need to abide by, and if you're, as a patient of them, improving and doing what is expected, then that physician group could see some additional dollars. If, however, they're not meeting those guidelines, they also can be penalized. So this is a newer product. Your doctor will notify you if you're going to be in the ACO, because you have an opportunity to participate, or you have an opportunity to say no. Your benefits don't change. Nothing changes about your coverage. It's just the information sharing that we want to do so that we can help across the continuum, across the nation, to improve care. So it comes into a lot of specialty items. However, if you went down the road with Medicare Advantage, you're not in an ACO. The reason for that is Medicare Advantage, remember, is a replacement of Medicare. Okay? So we don't participate in an ACO if you're already in a Medicare Advantage plan. Horizon Health participates in the Illinois Rural Community Care Organization. So they are a part of the ACO, and you probably have seen some letters. If you're doctoring here, you know what some of that is.